together.
You mentioned something earlier about drug rehabilitation, and you have something in mind that you would like to get going with that as far as sort of a summit for helping people helping people to recover?
Because the substance abuse issue is such a polarizing problem in our community, every day we hear about the terrible toll that substance abuse is taking on people's lives. We've been reading about the pill mills, the prescription drug problems, the overdoses. Young people's lives are really being terminated way too early, and I just think that that really is an important issue that we have to address. We have to close the pill mills, which we're doing. Recently, a law was passed that physicians now have to follow certain guidelines when they're ordering opiates or Schedule 3 and 4 drugs. So what I really would like to do is, in the end of February, we're hoping to put on a recovery initiative, and that means recovery is possible. People that are suffering from substance abuse, alcoholism, drug abuse, they will have resources in our community to go to try to help them. Right now we do have some mental health facilities that do treat drug addiction, but you have to have insurance. Right. And you know, a lot of people are suffering the same problems, and so we are really hoping to mobilize the community and put on a Hernando recovery initiative where we get all our physicians, our nurses, our mental health professionals, substance abuse counselors, social workers, educators.
Get them all in one place.
Get them all in one place. Get the education there, what the latest education is on addiction, brain, you know, the brain disease of addiction, the latest treatments. Talk about the recovery process, and then kind of a call to action of what we're going to do as a community to develop some resources, whether they're detox centers or rehabilitation, maybe outpatient counseling, some way that we can help these people that desperately need help.
Okay. And you have actually appealed to the leadership of the community. You mentioned that you had a couple of leadership gatherings to help get the word out about the clinic and let them know what your needs are and help maybe recruit some of their involvement too.
Yes, well, we have partnered with, as I said, the chamber, and we communicate with them on a regular basis. We have many, corporate executives that are part of our partnership. Bank executives. We have also other business partnerships that we really depend on when we need to go to and ask for help.
Right.
And they've been very forthcoming with helping us.
Okay. All right, so the great thing about the Community Crescent Clinic is that any involvement anyone has with it, whether they give a donation to it or whether they donate their services or any support they can give to it, it's all right here in our community. You know, a lot of times, while a lot of these other organizations are very worthwhile and very valuable, a lot of times your money will go somewhere else outside the community, but everything for the Crescent Community Clinic, of course, stays right here and helps the residents of our community. So yes, that's one of the great things about it.
Well, we have been putting on a little campaign about keeping it local because the needs are so great here. We really would like, people in our community, especially now during the holiday season, if they are going to be doing some charitable donations, we really would appreciate if they would keep it local.
Okay.
We have many worthwhile organizations here that the funds go directly to the people in our community.
Okay. All right. Well, Bev, is there anything that you would like to sort of sum up with talking about the clinic? I mean,
yeah, I would.
Okay.
If we all kind of keep in mind that it's the little things that we do that makes a difference. This way, it makes it so much easier to do big things if everybody just gives a little. Like we said, there's such a need in this community. We could be treating your family, your neighbors, your people that go to church, your people that you work with, and that's what we need. We need everybody to be aware of what's going on, what's out there, and every little bit helps.
Right.
And that's what we want to get
very
our
well said.
across. Yes.
And even if you don't need the help yourself, chances are you know someone, a neighbor or a relative or someone who is desperately in need of health care, and maybe they're not aware that this solution is there for them.
Absolutely. That's what
How about Maureen? How would you like to sum up with
Well, I
something?
really would like to, just say that there is help available. If people do need help, they can call the clinic and we can refer them to other agencies. We have Catholic Charities, St. Vincent de Paul. I think probably Daystar is still,
Right.
in operation. Jericho Ministries, to name just a few. We have the Dawn Center, New Beginnings Youth Shelter for people with children at risk, and there are really a lot of people in our community that want to help. And all you have to do is ask them and tell them what it is you need, and they will be willing to help. So if anyone is sitting home and they're having problems and they don't know where to turn, they can always give us a call and we will direct them to an agency or to help.
Okay, all right, well that's great. And we've put out a lot of really important information here today. I've really been wanting to do this show for quite some time now, so I'm glad we were able to finally get it done and help let our community know about the clinic and all of the benefits that it has for our residents. And thank you, the two of you, for your energy behind this clinic and for your volunteering and all of your efforts to get it going and keep it going. And there are so many people. If we were to start thanking people, it would go on and on. There's so many doctors and so many people that have been involved in getting it started and making sure that it grows in our community. So we just appreciate everyone's efforts so much.
Thank you for
Well,
Thank you for being
having
on the
us.
show. Thank you
Thanks
very much. Thank you for watching Focus on Hernando. We've been talking with Maureen Solomon and Beverly Riso with the Crescent Community Clinic, two of the many volunteers that make that clinic a viable force in our community and making it available to help those in need in our community. If you would like any more information about Crescent Community Clinic, you can go to the website, which is www.crescentclinic.org. Or you can also contact us here at Government Broadcasting and we'll put you in touch with Maureen and Bev. And our number is 540-6777. So thanks again for watching Focus on Hernando, and we'll see you again next time.